The Institute for Reproductive Medicine is an international medical center for the treatment of various forms of infertility. Our team of professionals offers patients a new level of quality in medical services. With more than 20 years of practical experience, we are leaders in the field of reproductive medicine. And as leaders, we also share our knowledge with colleagues from other medical centers. Our specialists conduct lectures and master classes for doctors from all over Ukraine and the CIS. At the Department of Obstetrics, Gynecology, and Perinatology of the P.L. Shupik National Academy of Postgraduate Education, which is based in our clinic. The physical and organizational structure of our clinic has been optimized to provide a complete range of care within the premises of the Institute. Patients receive consultation and care from the highly qualified specialists of our cross-functional team: gynecological endocrinologist, breast specialist, urologist, andrologist, obstetrician, gynecologist. Throughout the entire treatment process, from the diagnosis of the causes of infertility to the birth of the baby, a couple is cared for by our professional team. Prenatal diagnostics and pregnancy care. Our job is not only to achieve pregnancy. First and foremost, our goal is to ensure the birth of a healthy child while preserving the mother's health. Dynamic monitoring of the condition of both the pregnant woman and the fetus is performed by the obstetric unit. Prenatal monitoring ensures early detection and prevention of possible complications, as well as the elimination of congenital and hereditary pathologies of the fetus. The equipment of the obstetric unit of the Institute is ultra-modern. 3- and 4-dimensional ultrasound examination in real time allows us to see all the physical structures which are difficult to examine with the more common 2-dimensional ultrasound. It also reliably identifies the sex of a baby. Besides its medical purpose, the ultrasound in 3D allows parents to see a near photo-quality image of their child, the so-called prenatal painting. The 4D ultrasound allows us to observe the vital activities, movements, and reactions of the child in the mother's womb, and to start the creation of a video archive before the baby is born. Fathers participate in the process too. For the father of the child, the image is transmitted to a big screen, and this communication helps strengthen his psychological bond with the baby from the earliest stages of development. Our day patient facility offers a comfortable environment and services for our clients. A fully functional modern clinic providing assisted reproductive technologies is impossible without a specialized surgical unit. According to medical indications, minimally invasive endoscopic methods are applied. These techniques are often an integral part of the diagnostic process of the causes of infertility, preparing for the assisted reproductive technology program, as well as correcting possible complications. In vitro fertilization unit. The Institute for Reproductive Medicine specializes in diagnosing and treating all forms of infertility, including the most severe cases. One of our priorities is male infertility. Modern microsurgery methods of retrieving sperm from the testes or the epididymis allow for a significant decrease in the usage of donor sperm. As a result, men who previously could only rely on donor cells, in the majority of cases, now have the chance to have their own genetic child. Our task is not only fertilization, but also improving the quality of life of a man. A balanced approach to the elaboration of controlled ovarian stimulation protocols helps us prevent ovarian hyperstimulation syndrome. In order to prevent multiple pregnancy and miscarriage, we apply the selective transfer of 1 to 2 embryos, which corresponds to the recommendations of the world leaders in assisted reproduction. Alternative programs for helping our patients include preserving the reproductive function in cancer patients, assisted reproductive technologies for patients with spine traumas, and post-mortality reproduction. The high efficiency of our embryological unit is achieved by the following factors: high professionalism of our embryologist geneticists, and cryobiologists, availability of high-tech equipment and tools for micromanipulations, as well as using media from the leading manufacturer, and by maximum quality of technologies. The in vitro fertilization laboratory of the Institute of Reproductive Medicine is distinguished by its unique functional transparency. Each stage of the work is captured on a special screen. Patients can watch what happens to their reproductive cells and embryos and ask the embryologist their questions. The security of transferring biomaterials, ejaculate samples, ovocytes, embryos, etc., is controlled by a modern system of marking and identification, which provides a unique ID code for each patient. The work of our team is aimed at achieving a noble goal: the birth of a healthy child. Entrusting us with your most precious things, your own health and the health of your future child, you can rest assured that you have made the right choice, as we adhere to the primary medical principle of not serre, do no harm. The Institute for Reproductive Medicine was the first in assisted reproductive technologies in Ukraine, and today we remain the leaders in the field.